Awesome. Well, welcome you guys, and thank you, Melissa. Once again, we're meeting here, and our goal today, you guys, we want to, last week we started the conversation around autism, and today we want to carry that on a little bit further. And then I know what's really on our hearts to get into lineage of gut health, even in your ancestry, and how that might be impacting you in a few ways. So, we want to really just, our goal is to give you, again, hope. I mean, that is really our goal every time. And we know we're touching on some stuff that might seem hard to hear, but know that it doesn't mean that there's not ways to improve things, you guys. And as always, we're coming from a place of wanting to support and help you find alternatives that can help you and your loved ones feel and function better. And, as always, we're not claiming to, treat or cure anything. We're just trying to give you some thoughts and some ideas, and, talk about some logistics and even some barriers to that treatment. Because I know we're in a world, we're inundated with Western medicine, and there is a time and place for that for sure. So I'm certainly not saying there's not, and I know Melissa isn't either, but there's a lot of healing we can do that may seem atypical, but our medical system actually used to work this way, you guys. So
exactly.
This is actually the way things started. So I think it seems quote unquote new age now, but it's really not. It's actually where we came from. And so, what we're hoping to do is help highlight some of that so that your body can actually heal itself and recover, quite frankly, give you better outcomes. But I know we wanted to pick up, I know last week we started talking about heavy metals, and actually Melissa's going to share some really cool tests that she has access to now too for clients around this. But we're starting to talk about heavy metals, and I know this is a controversial topic in the world because people immediately get labeled, anti-vaxxers, and I think here's the thing I want to at least kind of have people think about, and I you can disagree with people, we can do it in a respectful way, right? But, if someone's questioning that, you guys, and certainly, I know it got very hot over the last couple of years, but I'm talking about in general. And prior to all that, I know I had a pretty bad vaccine injury about 10 years ago. I have a good friend who was paralyzed right after the birth of her son from a vaccine injury. And so I want to share that this has been going on for a long time. And it does seem to be linked to like a heavy metal poisoning that occurs. I do think that there is no coincidence that we have a lot of neurological issues going on here in our country, and we now require children to get way more vaccines than we were giving them 30 years ago, right? And you might know those exact numbers, Lois, but it's a massive increase. And I think it is remarkable that in the UK, they actually started to limit the amount of vaccines they're doing, and they saw a decrease in autism rates. And so, again, we share this from a place of, we want you to think critically for yourself, your families. This is in no way, any sort of like, if your kids have vaccine, you've done something wrong. I get it. And I think it's also challenging to navigate today's medical world, because I know I have been shamed in doctors' offices for my beliefs. I am just heavily rooted in them. So I have no problem standing up for myself. But it's very uncomfortable. I will be super transparent about that. So we respect and understand that, because I do think, unfortunately, a level of bullying happens in those situations. So hopefully we can give you some ways to also maybe advocate for yourself, if even, if you're going through this, if your children have had vaccines, maybe someone has a vaccine injury, I don't know, but there are ways to detox some of these metals out and see increased performance. So that's the hopeful side of it, is that, you don't have to stay in that space. But Melissa, I'd love for you to sprinkle in your clinical physical knowledge, because I know I just kind of set up 14 different sets of topics there. And
I was like, wow, how are we going to cover all of those?
I know.
I love that though. Yeah. Thank you for that intro. I really, really love that, because one of the things that, as I see working with, littles and, preteens and then teens and then older folks who have autism, is that sometimes it was very clear, like when we go back through the timeline, that it was a vaccine injury. And especially the people who have the care of, the moms, the dads, the grandmas, the grandpas, the people who chose to do the vaccine, oftentimes they felt like they didn't have a choice or that they wanted to do it. And then after, there is like, oh my gosh, what happened? And then there's the guilt that comes in. And I just want to echo what you said, Melissa, is that we do what we do and our choices are made from the best place and our best knowledge. They are. And I want us to sit with that and hold with that, especially if you're a caregiver and you're like, well, I screwed up. I want us to gently let that go and forgive yourself for what you didn't know. But on the other side of it, know that there are ways to help the body cleanse from that. There are gentle ways of really moving the needle for this dear person. So, there are ways to, like if it was a heavy metal reaction or the body not being able to extract those out. A lot of times it can be an egg allergy too, because that is used as a stabilizer in vaccines. Or it could be just the vaccines themselves. There was too much coming in at once and the body wasn't in a really strong place. So, there can be all different reasons why a vaccine injury will happen. But at this moment, I just want you to hold in your heart that you did what was best for your kiddo or your loved one at the time with the knowledge that you had. And please don't carry any guilt around it. There are ways to really support their body to become optimal, right? We can help clear that. And you started talking about heavy metals. And a lot of times when we are looking at, especially kiddos with autism, and especially when they're nonverbal, this is a piece. This is a piece of it. And normal, like traditional ways of helping people with autism don't go into necessarily this deep of discovery around what are the distinct factors that are actually impacting the way this person's body is able to work, how their mind is able to work, how their neurological system is able to work, right? So the basic tenets that I use are, what is getting in the way of the body being optimal? What do we need to move out of the way? And then what is missing? And so many times we find this to be the nutritional world. And this is something I feel like you can really speak into, Melissa, is that, I do that as well, but you have such a good little program that you help people with. But adding in the nutrition that the body needs. And sometimes we need to know specifics. Like, what are we missing in the Bs or B12, there's so much conversation around that. But I want us to also know, especially if you're a caregiver and you're like, I just want my loved one, kiddo, whatever, to have the very best life, right? That's what we want for them. So I want to share screen with you for just a moment and give you a little bit of a look at some testing that we can use to really help figure out some of the drivers, right? What's in the way. So, and I'm showing you this so that you can do some of your own research. I want you to do it, please. So you can go to Great Plains Lab. This is my favorite autism spectrum disorders panel. These are what we're looking for, right? We need to see what's happening in the cholesterol in the body. We need a stool analysis. And this is huge. This shows us the bacterial imbalances or balances, pathogens. We get to see any yeast or fungus. We get to see, it's not a really good panel for parasites, but we get to see some of that. We're getting to understand what's happening in the body that isn't optimal and why the body is having the expression that it does, right? Glyphosate, this is where we get into toxicity. We can do a full toxic non-metal chemical profile. This is really important. IgG food map, this is huge. The best metals test that we have right now is this metals hair test. This is really important. Omega-3s, and then organic acids test. All of these links, and maybe I'll put this link in with the video so that you can get in here, because here's articles, webinars, all kinds of things that you guys can tap into to really understand what it looks like to look at autism through the functional medicine lens and understand how we can actually facilitate optimization of the body.
And I want to point out a couple things on here, Melissa, just because, I mean, here's the thing, everything we talk about, you guys are going to start noticing trends, whether it's
right.
autism, anxiety, depression, which seems insane because they're such different disorders. But all right, first of all, and Melissa and I were talking about this because when you live in this realm where you have a lot of conversations about these things, you think everybody lives in this realm. And then I'm like exposed to like the world and I'm like, oh my gosh, so many people aren't talking about this stuff. I just happen to have a lot of like-minded people around me, which is what happens, right? Which is a great thing. So glyphosate, and Melissa, please correct me if I'm inaccurate, but this is really like Roundup, right? Is that not what this is?
Yep.
Okay. So if you guys have seen, you know, on TV, there's all these, you know, massive lawsuits around Roundup and people getting cancer. Roundup, you know, is a, my brain just went, pesticide that was created, and Monsanto really drove that, I believe, right, Melissa? And it was so we could mass produce foods, you guys. And so when you're seeing things that are genetically modified, this is the chemical, and it's causing massive disruption to people's bodies. You know, this is where we really started to see this whole term leaky gut. You know, people having IBS and Crohn's, and, you know, these things obviously existed beforehand, but we're seeing numbers so big since the inception of the use of this chemical. So again, you guys can certainly dig around. You'll find all sorts of stuff about that. I think it's hard to argue that this has not impacted us in a negative way. You know, people might argue, well, we've been able to grow more food in A, B, and C, but even in terms of gluten, you guys, the issue around gluten is not that wheat in and of itself is bad. I mean, when I was little, I actually ate gluten and I didn't react to it, but the bread I ate when I was like 2 is not the bread we're eating now, right? And so what they are now saying is you can't find gluten in the US that's not genetically modified, even if it says it is, you guys. And I actually listened to a whole very interesting podcast about that the other day, that's inaccurate, that companies make this claim sometimes and it's not true. And that's even scarier. But so glyphosate is for sure an enemy, and some people's bodies are holding on to it more than others. I know this is a huge piece of a lot of my issues that I had going on. Candida and yeast. So people, I don't think, know a lot about this topic either. I will share a little bit about my story because I think it's like the first time I learned that this was a thing. So I was in my 20s. A good friend of mine's mom was the one who started to talk to me about food allergies, all these things. And I had full body candida. And and I had, like, you know, this white film in my mouth, and I had no idea what it was, you guys. And even though at that point I was starting to eat really clean, you know, basically it's an overgrowth. Again, you can certainly add in here of you know, of bad bacteria. And I mean, I actually didn't eat any form of sugar, even natural sugar, for, I want to say it was almost a full 3 years, because I had it so extensively. And so, and that was just chronic antibiotic prescriptions, you know, and so that causes massive problems, obviously. So, you know, I think for women, you know, they tangibly think of like a yeast infection, which is obviously really unpleasant, but look at Melissa with her image. You're so good. But these are all pieces of this, you guys. And I think it's really important because, yes, you know, we think of when it shows up you know, in like a tangible way here, right?
Mhm.
But all these other pieces are a part of that.
Exactly.
And so even as far as like mood swings and things like that. And so it is
Mhm.
important. And if you are, you know, I think one of the biggest pieces is the sugar craving. I mean, you know, it's
That's a
terrifying when
telltale.
I think about the things I used to eat. Terrifying. But you know, like, and sugar is so addicting. But I think like if you're feeling that pull, and actually like, especially if people have drinking issues, and I believe, and I haven't
Mhm.
dug enough around in this, is that there's this pull to keep drinking has to do with the sugar, because there's so much residual sugar and alcohol, right? And so I know like whenever I was working with people in recovery, which I don't anymore, but they would be like, they'd show up with like all these baked goods, or like even one of my good friends, she doesn't do this anymore. She's been sober a really long time, but she would eat ice cream every night.
Mhm.
And I was like, what the heck, you know, like, why are you doing that? But it's the sugar cravings, right? So,
Mhm.
but then I love that you brought up the skin issues, because I always remind clients that if you have eczema, rosacea, psoriasis, there's something going on in your gut. Our skin's our
Mhm.
biggest reflector, right?
Mhm.
You know, even when like, I know if I'm having breakouts, like Melissa and I are working together, I know this is stuff getting purged out of my gut
Mhm.
that's coming out of my face, because I don't often
Mhm.
break out anymore. But I had horrific acne 20 years ago too, like
Mhm.
awful. And there's really, you know, yes, skincare can manage it, but you've got to do that internal gut work. That's going to really make a big
Mhm.
difference, right? So, and then feeling tired and worn down, you know, I think, and this is
Yep.
certainly, I mean, again, this could take us off on a whole different road, but you know, that buildup of bad things in your gut, people feel
Mhm.
tired and they just think that they're getting older.
Mhm.
But what it really is, probably, you guys, is just a buildup of like bad bacteria,
Mhm.
poor habits over time, potentially, you know, candida. And I know, yeah, like the skin and nail infections, but also, like I mentioned, if you get like this white film in your mouth, and honestly,
Especially
like,
on your
so
tongue.
yes, and I would get it like inside my cheeks, and I'm someone who obsessively cleans my teeth to the point where like I was told at one point by my dentist to stop brushing so much. So, you know, so I was like, oh my gosh, what's in my mouth? Like, this is disgusting. But it was just this like
Mhm.
yeast overgrowth. And so, so this is important for you guys to know. And you absolutely want to work with someone who, and this is actually a great point, the itchy ears, because, you know, again, you think it's, oh, I've got wax or whatever. If your body's healthy, your ears are pretty low maintenance. I mean, you,
Exactly.
again, correct me if I'm wrong, Liz, but like
Mhm.
if there's stuff like that going on, the bigger story being told somewhere else, typically in your gut.
Exactly.
And I actually think this is a great, well, I love that you have access to those tests, Melissa. And guys, please understand, one of the things that you know, is so cool is that, you know, she can look at this stuff. You know, we really kind of like, this is a really cool, why don't you explain what this screen is, Melissa? Because I think this kind of segues really organically into our next thing we wanted to chat about, which is just sort of lineage of stuff.
Mhm. What
Um,
happens in the gut?
yeah.
Yep. So this is a sample of a GI test, like a GI map. This is a stool test. We were referencing it earlier when we were talking about autism and the broad spectrum of testing that we can do to really zero in on what is actually driving that. So I'm kind of segueing off of your comments around, you know, itchy ears and, you know, things in the digestive tract that are off. And especially I hear this around gals that have continual UTIs or often have UTIs that are not yeast based. And their doctors are like, you know, they just give them something for and antifungal. When actually these two guys right here, well, these three guys right here, Staphylococcus and Streptococcus, they also live in our bodies anywhere there's mucus, including in our lungs, from the top of us to the bottom of us, right? And so sometimes we may have those reoccurring like itchy ears and even sinus stuff, lung stuff, UTIs. Sometimes this can be something that is part of the imbalance that can happen for like Crohn's and colitis. These guys are present, and a lot of times they are not looked for. And, you go to the doctor and they're like, well, you don't have any candida, we tested you for it, or you don't have fungus, we tested you for it, but you still have the issue, right? And they're like, well, I don't know what to do. We need to go after these guys, right? These are systemic. They live in our bodies. So,
and how would you, Melissa, like, how do you then, and I know this is going to be different for every person, but maybe zooming out, how would you as a practitioner, how do you approach the treatment of these sort of things? I know because we're doing it, but like for our audience members.
So this is the thought process that we go through. So say we did a GI map, right? And we have all this for you. We would look at first, what is your body telling us? Because I always want to listen to the body first. The body will never lie. Even if things on a test, we're like, okay, we listen to the body first. So we would look at this, match up what's happening here and what's happening in the body. Then we look at what is in the food choices and the lifestyle choices that is feeding into this. And then we use food again, and possibly some supplements, usually just herbals, to address this. But without the food and lifestyle piece, figuring out what is feeding this, we can pour supplements and herbs and stuff, and we can really help with it. But to really route this for now and forever, never, amen, the whys have to be uncovered. Does that make sense?
Yeah.
And we were, prior to our starting our call, when we were just talking before the recording, we were talking about akkermansia and how this, like, this is normal bacteria flora. This is what we're supposed to have, right? What we were looking at down here is opportunistic bacteria that can cause disease processes in the body. Especially these are potential autoimmune triggers. I'm not going to go into that. I could tell you what each one causes.
Well, I think I'm sure we'll do a multiple autoimmune
someday.
I feel like this is a great segue. So one of the things we were talking about, and this ties back into, I don't want you to think that we're like squirrel brain, because we're not, one of the things we were talking about was how your lineage, your ancestry can tie into what's going on, you guys. And I had read an interesting study the other day about, we think we're born with 100% clean liver. We're actually not. We inherit some liver issues from like our parents. And so most of us, if you're starting with like a really well functioning liver, what I read was it can actually only be at about 75% functioning, which is terrifying, to be honest with you, right? It's like, if you're starting with, like, I was like, wow, that's nuts. Like, to think that that's kind of the average that a lot of folks are being born with. And that's on like a best case scenario. And so, and again, this is, we think liver, I think we all can think of like, okay, there's alcoholism on this side of my family, or even anger issues. Anger is linked to your liver, and that's, whole other thing. We've got, and that comes from generations of repressed emotions, right? We live in a world now, we talk about stuff, we process things. That was not the way things used to be. Or eating habits. I know, gut flora, gut microbiome. And Melissa, you made such a powerful statement around, a degraded gut biome and how then it can actually keep getting worse. And when we know that the gut is the epicenter of a lot of these not only physical issues, but mental challenges that are going on, even anxiety, depression, like I know when I do an intake, if people are like, well, anxiety runs in my family. And it's like, well, ding, ding, ding. Of course it does, if you've got this. So I'd love for you to maybe explain a little bit about that, because I think it's like, for me, a big aha moment.
Right. So let's think about how our great-grandparents ate, right? And how they lived. And our microbiome, we get the biggest inoculation for our microbiome from our moms, especially at birth, right? So think about natural birth and what happens. and how the amniotic fluid is ingested into the child. So think about great grandma and then had your grandma, right? So that was inoculated. Think about the change that happened in her world and her time around food, around electronics, around travel, all the things that happened, like that were changing in our world. Think about then your grandma to your mom, what was happening there, and the change. I hesitate to say use degradation until we get into our last two generations, because that's where we see the most change in our bodies not being able to support, a really well-rounded, healthy immune system for more people. So thinking about coming from your grandma to your mom, and then your mom to you, right? So each time there's change in the microbiome, because potentially, especially if your mom was not terribly well, she passed that on, the same tendencies, what she had in her gut, a lot of it was passed on to you. Not only was the actual beginnings or seedings, if you want to say it that way, of your gut from her, but you also learned how to think about things. You learned how to talk. You learned how to live. You learned how to think about food and taking care of your body. You got all of your, so many times we transfer down like guilt. We transfer down how we learn how to be in relationships. We learn about boundaries or no boundaries. All of this, when we say chronic illness is family, it comes down as to our family. These are the ways it happens. And it's not always that, like MS is in my family, for example.
Yeah.
It's not always that, because my grandma and my mom have MS, then I'm going to have MS.
Mm-hmm.
It's that I have the tendency toward it. I'm set up for it, right? So thinking about the pieces that we can change, like I'm completely recovered from it. But it's like, we can break the cycle. We can understand those pieces, parse them out, take some work, but we can break the cycle. And the same thing goes for our kiddos who have autism. Guys, we can break the cycle and we can really uncover what's driving that for them, and then optimize what's happening in their body.
Yeah, and I want to say, if people haven't heard Melissa's story around MS, go back to our first video, because she talks about that, and it's crazy. I know the first time when I chatted about that, I was like, holy Toledo. But I think, what you just said was really powerful, because as you were talking, I was thinking about, like, man, my mom loves sugar. She loves carbs. And then she wasn't a really good eater for so long. She was super, super, super skinny for a really long time. And then, she finally started putting on like weight, as she got older, but, like her metabolism, I'm sure, is not functioning optimally. Right. And so, which, whatever, there's no judgment there. It's just around the patterns I picked up. Like, oh, no wonder, and I think it's, I know we were talking about too, in terms of, weight, like, I know for women, weight's a huge issue. And so, okay, maybe, one of your parents is, just heavier set or whatever. And you come into this world and you're pre-programmed to be built this way, but also you've got this gut kind of, we'll call it like a blueprint.
Terrain.
Yeah. You've got like this being handed over. And then, so this is why, you can have multiple people doing the same, eating program, workouts, all the things, and they're going to have different results, right? Exactly. Which is really why, I think, I focus on just helping people learn how to eat whole, real foods and adding nutrition, because everyone's going to have different results, and even within that, like, some people drop a tremendous amount of weight or inches, some people just feel better. And so I think, a big shift for myself has been, not dealing with the number on the scale, it's like, how do I feel in my body? Do I feel like it's reflecting the work I put in, but also you know, how is my health, right? Like, do I feel like things are working properly? And so, and you know, we're inundated nowadays with all these different types of diets, and keto and paleo and blah, blah, blah. And the thing is, you guys, is that, yes, maybe those have worked for someone. So, you know, I don't think that it's inaccurate that someone's trying to share that, because if they had great results, cool, right?
Yeah.
But, you know, it's, you know, I remember when I had first heard about like the carnivore diet, and I was like, I could never live without vegetables. I love them, you know? And so it's like, how do you just eat meat and eggs all day, you know? But, you know, for people who have done it, maybe they were highly carb addicted, whatever, you know? So my point is, you know, trying to approach your health from the stance of what helps me feel like I'm functioning my best. And I know we wanted to touch upon barriers, because I think this is really important, you guys. And one of the, you know, the highlights I do want to give about Melissa and how she helps treat people is she really tries to work with your resources you already have. So what do I mean by that? I've worked with a lot of functional practitioners. They're all wonderful. So I'm by no means saying that they were not, but it's challenging because it's not always cost effective. What I appreciate the most about Melissa is she tries to figure out what can we get covered by your insurance, and how can we really optimize those things so that we can focus whatever resources you have financially towards other things she can provide that you can't get elsewhere. And I think that's really cool, Melissa, because that's the reality, right? Like, especially right now during these times, people are not where they were a couple of years ago financially. And but you want to make sure you're taking care of your health, or you know, want to obviously be in a better place physically. And how do we do that within some of these restrictions? And so I know I personally appreciate that you do that, but I know, I'm sure all your clients do, because it's much better to get at least testing done through insurance than have to pay for all that out of your pocket, right? Like,
exactly. Yeah. So thank you for that. I appreciate that. But
so I
that
think those are
comes
some things you do that I think are really special, to be honest. Yeah.
Thank you. Because I've been there, done that, right? Because I've had my own big journey, right? And I know how it feels. And I also know how it feels to walk into a situation and go, that you're like, oh my gosh, I could so do this. This is what I need to do. And then hear the price tag and go, well, I guess I can't do that. So one of the things that I've been working on, like the testing that I just showed you guys around autism, we can get most of that covered by insurance. Often we can get blood work covered by insurance. Most insurance companies will reimburse for supplements. There are ways to do this, and I've got my CD codes set. So if your insurance reimburses you for things like health coaching and nutritional coaching and that type of thing, you'll be able to use your notes and turn them in to your insurance company and get at least a portion of those reimbursed. And what portion of that will be up to your company. I don't turn anything into insurance, but I give you everything that you need to do that. But it opens up a way for people to be able to, because this is a terrible business practice, and I feel like I'm just totally talking about myself here, so I apologize.
Oh, you're not. I think this is important to hear.
What I want you and what my team wants for each one of our clients is for them to get so well, sustainably well. They know how to stay well. Like, we've taught them this whole way to be well. They know how to do this, that then they don't need us, right? And I know it's a terrible business practice, but that's when I'm like, okay, I have done my job well, when this client is able to walk away with confidence that, okay, my body's good and I know how to stay well. And then just pop in when things go sideways, because they will, life happens. Go, look, I've done this and this and this, I've tried this and I can't figure it out. Help me figure it out. It may be just a quick, single consultation. They're off on their way again. That's what I want for my people, because this doesn't have to be forever.
Well, I think it's a phenomenal business practice, plus, because I mean, gosh, I mean, I've referred you to so many people already. I mean, I've been sending out your little QR code everywhere over the last few weeks. But I mean, when people are feeling better, what better testimony than that? Like that this, because we do live in a world where our medical system keeps us sick. So we are continuous patients,
That's
right?
no way to live.
No,
I'm
it's
sorry.
not. It's not. And it's like, and by the way, it's so frustrating because it's like if we help people get better, then people are going to be like, no, you have to go work with this person because they help me so much, right? And so, I mean, I think that's a much better system than keeping people ill so that they're lifelong clients, right? And so I love that. And I think it's really important for people to understand because, I think for both of us, the goal is to help people feel better. Well, I know that's our goal. And I know that, we do it in different ways, but it does all really work together. And I think it's important for folks to understand, if you are listening to this, well, how the heck do I heal generations of damage? You can, you guys, I mean, I have a dear friend and I adore her so much. And she had a really traumatic childhood. She's like the healthiest person I know now. She was an alcoholic. She was hooked on cocaine. She is like just such a bright light in the world. You can't help but smile around her. And she's a great mom. And all these things. She broke all these curses. It was just consistent work and leading into it and, massive lifestyle changes, right? But she's broken really crazy chains off. And so, I think that that's where it's like, you can, and everybody can. And again, it's the work and it's just knowing that, you can change whatever the circumstance is, if it's something physical that's going on, I said to Melissa, it's kind of a relief knowing, okay, some of this stuff isn't mine that I've inherited, right? So I can work on it and almost allows you to release it in a different way.
Yes.
It's mine.
Yes.
Right?
Thank you.
I don't need to hold on to that. That is not even mine to begin with.
It's not yours. Yeah.
That's really freeing. So, I hope, again, if you listen to this, you're like, oh, okay, I can put that down. Right? I mean, how many people I know I would talk to people, this was in my early days as a therapist, and people would start using with their parents. And that always broke my heart. But it was like this expectation. But it's like, what's the difference between the person who continues and the person that says, this is no longer my story and they stop, right? And that's just one example. But I remember whenever people would, it was always some very young age and it was always with a parent and I'd be like, what? But it was also a really powerful testimony when you see those people that are like, no, that's not my story anymore.
Exactly.
And again, I think that's an extreme, but a lot of us are dealing with some level of these things. And even if it's physical, right? I know I came in and shared Melissa, okay, I've got this gut stuff going on. We're working on it. We're fine tuning. And I'm a person who takes my physical fitness very seriously. And I'm like, but I'm not getting these results I want, but we're realizing why, and we're digging into it. But now I'm like, oh, because, the microbiome I started off with isn't the same as, my friend who had a healthier start in her gut. Right. And and it's not with any level of judgment. And again, it's kind of freeing to be like, okay, there's nothing else for me to eliminate, cut out. It's just continue to heal. Right. And so that is super freeing because it's like, okay, just keep focusing on health and restoration, So
may I make a comment about that?
Of course.
So I really, really love how you have been putting that together, right? About, what's ours and what's not, and what's, kind of come down to us and what we can put down and let go of, because it's not ours. And I want to kind of shift that just a little bit to us as mom and dads and us as grown adults. Look at all the people that you get to touch every day, Melissa. You get to choose whether you carry on the generational things or not. Like for me, one of the things that I vowed, I was not passing MS on to my boys. Wasn't going to happen. It stops here. And it's changing all the parts and pieces in our lives, and with them to be able to then go, no, it's not going to happen after me. You know, we get to do that. We get to make those choices. You're making that choice right now. And I want everyone, if you're listening to us, please hold that power in your heart that you have. It's yours. You get to choose what you continue and what you break for your family. You can break it for your kids. You can make new, how do I say, new realities, new realness in your family. So you don't have to bring some of that junk that came for you.
I love that. It's like a new foundation and infrastructure,
Yeah.
right? Whole new building.
Yeah. But we get to do that, right? And sometimes we forget that we have the choice. Maybe we don't even realize we have the choice.
Well, I think it comes from, it's the friend I spoke of. I mean, I'll share this and she'd be totally okay with me sharing it because I've shared her story many times and I had asked permission before. She was actually sexually assaulted by her own mom. And I remember when she told me that, I was like it's gut wrenching, right? Like I used to work with kids going through stuff like that, but here's this person again, like she's just like a beam of light. And I'm like, how do you get beyond that to become this like whole wonderful human who is like, showing up in such a loving, caring way for her kids? But that's part of the reason why she's such a great mom. It's like, I'm not continuing this, and she's done a lot of work around the healing. And again, this isn't mine. And then boundaries to be able to set parameters for safety, and I got to heal, and I think that's the thing, right? And boundaries, you guys, like, man, gut health, as you increase your gut health, I will say my boundaries have gotten firmer. It's like the firmer my gut gets, the firmer my gut.
I love it.
Both internally and quite frankly, externally.
I love it. I love it.
Well, I just think, I hope you all have stuck with this watching it. I know we've kind of veered, but it all does tie back together because it's important to understand, like, there could be things going on that, again, you didn't create, but you inherited. You can help fix and change them, and you can change your story for your kids and going forward. And there's help. I mean,
and yourself.
Yes. And I think you owe yourself to show up how you want to be in this world. And it doesn't mean it's not going to take work, but man, like, it's so worth it when you start to feel different, right? And
it is so worth it.
And I think too, and I know I always advocate for folks to connect with Melissa, but really I mean that, because if you've got any of this stuff going on, you guys just have a conversation with her. I know I just referred a friend of mine whose son is going through a lot of stuff. And I'm like, I don't know, maybe he's got a parasite. Like, I just was like, there's something wild going on here. And I don't know what it is, but I just think it's so important to, people knew how much healing could really be at their fingertips. And so I think we just want you to know that, and you can change it no matter how old you are either, quite frankly. So
love that.
We hope this is helpful. As always, Melissa, great conversation. My goodness.
I love these conversations.
It's like, I feel like I was like, man, and then I like, it's so wild. Like, and then I'm like, oh, and I read this and I heard that and whatever.
I love it. Yeah.
But it always connects back to all the things we're talking about. So, well, I have found this hugely helpful, even for myself. I feel like every time we talk about it, although John Maxwell calls that information integration, right? It's part of the leadership cycle. So I feel like our little powwows every week always help me to just reroute down into some of the stuff we're talking about too.
Exactly. And I kind of want to leave us all with just the understanding of how much choice and how much power we have to be well.
Absolutely.
And I think we forget that a lot of times when we're really sick, or if we are caring for someone that is really sick. And in the traditional, if you want to say it that way, medical world, there's not a word or a whisper said that you can change this, you can optimize this, you can get better. There's no word or hope like that said. And I would just want you to kind of lean into, what does your inner wisdom say? What does your heart say about your own wellness, or about the wellness of the person that you're taking care of? Because that inner wisdom, intuition, that's what we need to listen to and follow. And whether it's working with Melissa, or whether it's working with me, or finding somebody in your circle, in your area that you really resonate with, that can help you, please do it. Please follow that intuition, because you have no idea how far this can go. Like when I started the journey, nobody ever told me that I could get well from MS. Nobody mentioned it at all. I didn't know. And then I started to get better.
Yep.
Right? So trust the intuition. I knew I could. I knew inside I could. So listen to that and know that it's out there. Keep looking, keep finding, but don't let that power go.
That's a great way to put it. If the vision's in your mind's eye, it's there for a reason, and it means that you can get there,
Exactly.
Love that. Well, another good one, my friend.
Awesome. Oh, hugs. Guys, have an amazing rest of the day.
Thank you
Take
guys
care.
so much for watching.